Good morning, everybody. The Deputy Minister of Health, Secretary of the Ministry of Health, distinguished guests. Today, I'm here to talk to you about strengthening antimicrobial stewardship to combat antimicrobial resistance. And I'm Dr. Taib Sali, the Infection Control Officer and the Secretary of the MS Committee at King's Hospital, Colombo. King's Hospital is a 120-bed multi-specialty hospital located in Narahambita, Colombo. We cater to approximately 6,000 patients per month. Next slide, please. These are the clinical services that we provide, and we have all the major clinical specialties included. Next slide. The AMS activities implemented at our hospital. We initially established the AMS committee, which has all key members from different specialties and also different departments from the hospital. It is chaired by the Director of Medical Services, Dr. Shani Silva. And next slide, please. We have implemented the antimicrobial prescription chart. So this chart is very similar to the one in the government sector, but we have made minor changes after consulting our medical officers and senior nurses. So we have also prepared the antimicrobial policy, taking into consideration the VAC classification and the Sri Lankan antibiotic guideline. So this is what you see on the screen is the antibiotic card that we've introduced. This antibiotic card has the patient's details. We have the indication for treatment as well as the dose frequency. And the adverse effects, you can see the allergies. So this is important for us to trace previous antibiotics that we prescribed. And this is taken to any hospital. It doesn't have to be at King's Hospital. When the patient goes to another hospital, the medical officer can actually have a look and see what antibiotics this patient has been on before. So we have distributed aware classification posters to all the wards, to the OPD, to the ETU, and every consultation room has the aware classification poster on the wall so that our consultants can review it if they need any reference. So we also have had other awareness posters in all the common areas for the patients to educate themselves on AMR. So we have recruited a clinical pharmacist who's helping us with the whole process. And we have actively participated in the online WHO AMS sessions with CMC Vellore, as well as local mental hospitals. We've been monitoring all access, watch, and reserve antibiotic movements from the hospital, and we identified that certain watch and reserve antibiotics have been prescribed more often. So this is a vital approach that we are taking, because we have also had sessions with our doctors, we've educated them, and we told them the importance of safe practices. And then we've analyzed the basic microbiological data, such as the cultures and resistant patterns. So we have done this manually since we are still not full-blown when it comes to the WUNET system. The previous slide, please. Okay. This is the WUNET training that we had at the hospital, and we thank the Ministry of Health. We had Dr. Hamza and Dr. Kasun present. And we have trained our IPC team as well as the lab MLTs. And we are in the process of integrating the hospital system with the WUNET system. We have distributed extracts from the national guidelines on antibiotics. And we have selected 4 key infection categories. We've started small, so these are the 4 key infection categories such as diarrhea, respiratory tract infections, sepsis, septic shock, and UTIs. So we've got the consultants on board, and they have agreed to our plan. The future of AMS. So these are the activities we plan for the future. So we have planned to have a point prevalence study on inward patients on antimicrobials, and we want to have a pre-authorization for reserve antimicrobials because we are still not there, but we do get notified if any reserve antibiotic is being prescribed. But for now, we have planned so that we need to have better control of prescription of reserve antimicrobials. We're planning to do consumption audits, provide antibiograms using the WhoNet software, audits on indication to use antibiotics, to review the antimicrobials every third and seventh day, as well as ongoing surveillance on antibiotic use, HAIs, resistant patterns, and feedback to prescribers. The Wow Week. So we're excited for the Wow Week, and we have planned a few activities. So we are planning to eliminate the hospital premises in blue, and we are planning to educate our staff members to have awareness programs for nurses and doctors. We're also planning to give our staff members a blue ribbon to be placed on the left front of their uniform. And we're also planning to display antimicrobial resistant awareness posters in the common areas for our patients. And we're going to use our social media platform to share AMR messages to the public. So I thank you all for this opportunity. And since the officials are here, I have a request. Yes, we have guidelines and circulars for the safe practice and safe prescription of antibiotics. But I think we should be a bit more stricter with the guidelines to all the doctors. So please, I hope you all take that into consideration. Thank you. Let's act now. Let's protect our present and secure our future. Thank you.